There is a new message from the head of the Rhode Island Department of Health. Everyone 18 and older in Rhode Island is likely eligible to get a booster shot.
Dr. Nicole Alexander-Scott said that's because the state's transmission of COVID-19 puts people at a high risk for exposure. Right now, the state is reporting a 5.1% daily positivity rate and 516 new cases today. To put it in perspective, the last time we saw over 500 cases in a single day was April 9th.
12 News reporter Alexandra Leslie was at today's news conference. She joins us now live from Providence with how state officials say we should take this into consideration ahead of the Thanksgiving holiday next week. Alex?
Well, Mike and Shannon, while we're in a much different place this year compared to last Thanksgiving, both Governor McKee and Dr. Nicole Alexander-Scott say that even though there are now vaccines, not to let your guard down. Nearly 93% of Rhode Islanders 18 and older have received at least one dose of a COVID-19 vaccine, with just over 84% fully vaccinated.
But that doesn't mean that we're not going to be cautious about the measures that need to be followed.
Dr. Nicole Alexander-Scott says in addition to getting vaccinated, the mitigation efforts we've had all along are still needed.
It's getting tested regularly. It's wearing a mask, particularly indoors. It's keeping the distance, particularly if you're in a crowded space.
But in addition to the vaccine, the health department director says she is strongly encouraging everyone over 18 to get a booster shot.
With all of us moving indoors and with higher levels of transmission, as we've talked about here in Rhode Island, most people 18 to 64 and older find themselves at some higher risk of exposure.
With substantial or high transmission, the CDC recommends even fully vaccinated people wear masks inside public areas. I asked Governor McKee if there was any thought of re-implementing an indoor mask mandate given Rhode Island's numbers.
I never discount anything, but at this moment in time, I think that we will proceed as we are right now in terms of the masking policy, which is in the schools and in other areas like the hospitals and other areas like that.
Governor McKee also gave an update on Rhode Island kids ages 5 to 11 getting vaccinated, saying 13% of the 80,000 eligible kids in that age group have gotten the vaccine, adding over 10,000 are on their way to full protection against COVID-19. Live in Providence, Alexandra Leslie, 12 News.
More breaking news. The New York Times reports the FDA plans to authorize Pfizer boosters for all adults by the end of the week.
Here in Rhode Island, the message from the health department is that everyone 18 and older get a booster shot, with infections on the rise again. The Rhode Island Department of Health reported a 5.1% positivity rate today, with 516 new infections. It's the highest single-day count since April 9th.
12 News reporter Alexandra Leslie joins us now with why the health department is recommending boosters ASAP and how this varies from the initial guidance. Alex?
Well, Shannon and Mike, Dr. Nicole Alexander-Scott says that's because right now there's been an uptick in cases in the last several weeks in the state, and based on the numbers, Rhode Island is now considered to have high transmission of COVID-19.
Our percent positivity was 3.2% last week, which is roughly double what it was only just a month ago.
About a week after celebrating its first homecoming dance since the pandemic started, Pilgrim High School is experiencing a COVID outbreak with about 25 cases identified among students and staff. It forced the school back into remote learning through Friday. Dr. Nicole Alexander-Scott's continued message is to get vaccinated.
The rate among unvaccinated people is roughly 3 times higher than it is among vaccinated individuals.
Keeping that and the state's transmission rate in mind, she says based on the emergency use authorization for boosters, most people between 18 and 64 and older likely now find themselves at higher risk of exposure.
That means you can get a booster dose. We want to strongly encourage that.
The CDC guidance states people 65 and older, 18 and older in a long-term care setting, or 50 and older with an underlying medical condition should be vaccinated. There are other groups like those 18 and older with medical conditions or who work or live in a high-risk setting that the CDC says may get one. But Rhode Island's numbers have the health department director urging people to get boosted when eligible, 6 months after a Moderna or Pfizer shot or 2 months after J&J.
The winter is coming. Our cases have gone up. Everyone 18 and older is at higher risk of exposure.
Governor Dan McKee says 105,000 doses of booster shots have been administered since September, meaning about 24,000 Rhode Islanders have been rolling up their sleeves every week. He says if we continue at this rate, then the state could have 100% coverage of people eligible boosted by January. Reporting live in Providence, Alexandra Leslie, 12 News.